Bringing a new life into the world is an incredible experience. As an obstetrician here in the UK, I've helped thousands of mothers welcome their babies. While the anticipation is exciting, it's completely normal to feel a mix of emotions as your due date approaches. The key to a positive experience lies in preparation. Preparation empowers you to approach labor and delivery with greater confidence. It allows you to understand the process, manage expectations, and make informed decisions. By taking proactive steps, you can reduce anxiety and feel more in control. This journey is unique for every woman, and it's important to remember that there's no one-size-fits-all. In this guide, we'll explore practical tips and expert advice tailored for expecting mothers here in the UK. We'll cover everything from mental preparation to physical well-being, ensuring you feel ready for the big day and the arrival of your little one. Let's get started on this exciting journey together. Mental preparation is just as important as physical preparation when it comes to labor and delivery. Equipping yourself with knowledge and coping strategies can significantly ease anxiety and foster a sense of calm. One of the most effective ways to prepare mentally is attending antenatal classes offered by the NHS or private providers. These classes provide a comprehensive understanding of the labor process, pain relief options, and breathing techniques. They also offer a safe space to connect with other expectant parents, share experiences, and build a support network. Alongside classes, practicing relaxation techniques like deep breathing, meditation, and gentle exercise can be incredibly beneficial. These practices can help manage stress, reduce anxiety, and promote a sense of calm throughout your pregnancy and the birthing process. Remember, knowledge is power. Familiarize yourself with the different stages of labor, pain management options available to you, and potential interventions. This understanding will empower you to make informed decisions and feel more in control of your birthing experience. Physical preparation plays a crucial role in ensuring a smooth and comfortable labor experience. By focusing on your physical well-being, you can support your body's ability to cope with the demands of childbirth. Regular exercise during pregnancy, as advised by your healthcare provider, can strengthen your muscles, improve stamina, and boost your mood. Opt for gentle activities like walking, swimming, or pregnancy yoga. Maintaining a balanced and nutritious diet is vital for both you and your growing baby. Focus on consuming plenty of fruits, vegetables, whole grains, and lean protein. Stay hydrated by drinking plenty of water throughout the day. Pelvic floor exercises are another essential aspect of physical preparation. These exercises help strengthen the muscles that support your bladder, bowel, and uterus, which can be particularly beneficial during labor and postpartum recovery. Remember, it's always best to consult with your healthcare provider or midwife before starting any new exercise regime or making significant dietary changes during pregnancy. As your due date draws closer, packing your hospital bag can bring a sense of excitement and readiness. It's a practical step that ensures you have everything you need for yourself and your newborn during your hospital stay. Essentials for your hospital bag include comfortable clothing, toiletries, maternity pads, nursing bras, a going-home outfit for you and your baby, and any personal items that bring you comfort. Creating a birth plan is another important step in advocating for your preferences during labor and delivery. A birth plan outlines your wishes regarding pain relief options, birthing positions, and any specific requests you may have. While it's important to have a plan, remember that labor is unpredictable. Flexibility is key, and your healthcare team will always prioritize your safety and well-being. Discuss your birth plan openly with your midwife or doctor, ensuring they understand your preferences while acknowledging that adjustments may be necessary depending on the course of your labor. By packing thoughtfully and communicating your wishes through a birth plan, you can approach your hospital stay feeling prepared and confident.